Hello, Miss Smitherman. My name is Mia, and I will be your nursing student for today. Are you okay today?
Mhm.
Okay. Is it okay if I give you a head, face, neck, and lymphatic assessment?
Yes.
Okay. Then I would wash my hands and put on my gloves. So, have you had any health history with those four categories: the head, face, neck, or lymphatics?
Not that I know of.
Okay. Have you had your tonsils removed?
Yes, when I was younger, but they don't bother me anymore.
Okay.
So
All right.
all good.
We're going to go ahead and get started with your head. So when looking at Miss Smitherman, her head is symmetrical and the shape of her head is round. And then I would move on to see if there's any masses or nodules on her head. Okay, there are no masses or nodules present. And now I would move on to her face. Have you had any issues with your face in the past time since we met last?
Mhm.
Okay. I would first check to see if our features are symmetrical, so that includes her eyebrows. Okay, her eyebrows are symmetrical, her lips look symmetrical, and her ears are symmetrical on her head. Can you give me some sort of expression? Okay, so everything still is symmetrical whenever she smiles. And now I would check for any edema present. Okay, there is no edema present on her face. And then now I would move to her sinuses on her face. So for the frontal sinuses, I want you to close your eyes and I'm going to check right underneath your eyebrows. Okay, and now I'm going to check your maxillary sinuses. Okay, her sinuses are not enlarged or inflamed, so that is good. And now I'm going to check her temporal artery. Okay, there are no abnormalities there. And now I'm going to check her TMJ or temporomandibular joint. Okay, will you open your mouth? Okay, close, open, close. Okay, there is no popping or any noise associated whenever she opens and closes her TMJ joint. So I don't think there are any abnormalities with your face. And now we're going to move on to your neck. How is your neck? Has everything been okay? Any soreness, stiffness? Okay. So first I'm going to examine the shape, and it's the normal cylindrical shape, and the size is normal. And now I'm going to examine your trachea. Okay, the position is normal, right in the midline. And now I'm going to examine if it's symmetrical. So would you tilt your head back? Okay, yes, it's symmetrical on both sides, right in the middle. Okay, and then I'm going to check to see if you have strong pulsations right here on your neck. Checking one at a time. Okay, good. And now I'm going to check your thyroid. So here is your glass of water. Okay.
Yeah.
So take a sip, but leave it in your mouth. Okay. Stop, don't laugh. Okay. Now, I'm going to displace your thyroid with this and turn to the right and down and swallow. Okay, good. And take another sip if you don't mind. Okay, and now I'm going to displace it this way. Turn to the left and down. Good. Swallow. Okay, good. So her thyroid is normal and symmetrical, and it is, here, I'll take that from you. Everything is normal with your thyroid. So now I'm going to move on to your muscles in your neck, and that includes your sternomastoid and your trapezius muscle. So for the sternomastoid, we're going to do a couple exercises to see your range of motion for it, but first I'm going to check the symmetry. So look at me, okay? Okay, and I want you to turn to the left first. A strong all the way turn, okay? It's symmetrical on this side. Now turn that way, please. Symmetrical on this side.
What's this muscle called?
Sternomastoid.
Okay.
Yeah. Okay. And now we're going to check your trapezius muscle, which is the triangular muscle that kind of sits on your shoulders. Has there ever been any soreness with that muscle?
Just after physical activity, mostly.
Okay. So
it goes away.
We're going to check it. Okay. To check its range of motion, we're going to do some shoulder shrugs. Okay, so shrug up. Okay, shrug down. And shrug up. And shrug down. Okay. And moving back to the sternomastoid, I'm going to check your resistance for that muscle. Mm-hmm. So whenever you turn to the left, I'm going to provide some resistance to make you turn back to the right. Can you turn back to the right? Okay. And then when you turn back this way, I'm going to try to provide some resistance there. Okay, so she has good strength in her sternomastoid. And same thing for the trapezius. We're going to see your strength in that. Okay?
So shrug up?
Yeah, you're going to shrug up, and I'm going to press resistance down. Okay, one more time. Up. Okay, so she has good resistance in her trapezius muscle. So we've done your head, your face, and your neck, and now we're going to move on to your lymphatics. Okay, so for the lymphatics, I'm just going to massage in certain areas on your face, your necks, and your arm, and one on your chest to see how freely movable they are and if they are inflamed. So we're going to start on your face and your head with the right above the ear, the pre-auricular. So these are in the front, and then the post-auricular are behind your ear. And those are normal, they're not inflamed. No abnormalities present. And then we're going to move to your occipital, which is behind your head. You can keep your head straight. Behind your head. Those are good there. And now we're going to do your submental and your mental and your submandibular lymphatics. Okay. And then we're going to go right here. Everything's good there. And then I'm move on to your tonsil area. These are the ones that you can feel really well. Okay. And now moving even deeper into your neck and your clavicle, we're going to check your cervical chain, which is a little bunch of lymphatics that go right through here, okay? Just going to check those on both sides. Okay. And moving on to your clavicle, we're going to do above it, which is supra, subclavicle. Sorry. And any other. Okay. All of her tonsils in her face and her neck are normal. There are no abnormalities present. So moving on to your arm. Sorry. Okay. Hold your arm out like this, and I'll hold it for you. We're going to do our lateral lymphatics. And then moving on to her axillary. It's okay. Okay, those are all good. And then where her underwire is on her bra, I'm going to check her pectoral lymphatics. Okay, good job.
You check this one?
Yeah, I need to check this one too, if you don't mind. Okay, can they see? Yeah, that's pretty good. I'm going to check your lateral. Here, hold your arm out like that, yeah. And then her axillary. Okay. And then again, where her underwire is, I'm going to check her pectoral. Okay. Do you have any questions?
I think I'm okay.
Okay. And everything looked good. There was no nodules on your neck or where your thyroid was. Those were all good. Everything was symmetrical on your face and your head, and all of your lymphatics, your lymph nodes, they all are very normal, freely movable, and no nodules present. Do you have any other questions?
No, I think okay.
Okay, so then I would wash my hands and dispose of my gloves properly.